So Saul, I know you and Luis hit like the top producers for ACA, which is amazing. What I wanted to know is, I'm glad to hear that you're approaching businesses, but when you go into the businesses, what are you saying? How are you offering your services?
Well, it's kind of a win-win situation because a lot of employers don't or want to pay for their group coverage. So we go in there and say we can work with your employees, and offer these low-cost health coverage plans, because a lot of the businesses that we target are employees that have low or type-paying salaries or incomes. So because of that, the employees have access to these lower costing ACA plans. A lot of times $30 or less, in some cases $0, but free doctor, no doctor cost, $5 specialist, stuff like that. So it kind of takes the, I guess you could say, pressure off the owner, and you go in there with the plans, and it's kind of a win-win situation for both.
Do you call it head or door knock?
I just show up.
I love it.
Yeah, I just don't knock.
Excuse me, how do you offer outside of the enrollment period?
Typically it's SEP in this particular year. We have the low-income subsidy situation coming up. I guess I could say that I'm kind of lucky in that the area that I'm in, which is South Texas, there happens to be a lot of lower income type folks, that make lower type incomes. So it's going to open it up to, I'd say, over 90 to 95% of the people that we can offer it to, which is a lot of people. So that's how we keep it going year round, month after month.
So I'm buying a house out there.
Yes, sir.
So it seems like most questions are coming to you. My bad. But I do ACA. I've been doing it part-time. I had a second job, but I have about 300 or so ACA customers. But I want to know kind of what you do for renewals, because with over 1,000 customers, I have to, I try to make sure that I actively renew every single customer, because if you let them passively renew, just go and they get put into a plan that maybe doesn't fit them anymore because a new company came in, new plans came in, and where there is a $0 plan maybe that is better for them this year. Last year they had a different company, and if they stay, it's going to be $100. So kind of what do you do? Is it just yourself, or do you have assistance?
Yeah, it's important. It's a good question. So it's not only important to acquire new customers, but it's also important to keep them. Because if you're bringing in, 150 a month, but you're losing 100, it doesn't do a whole lot of good. So yeah, I took a leap of faith, put out some money, opened up a little office. I've got some customer service help.
How many?
2 for each office. There's 2 offices. So those help me out in helping retain a lot of the folks with customer service issues, making sure their payments are done on time, documents are sent in on time, and everything is taken care of. As far as the plans, some plans cost more, some cost less, but I like to focus more on presenting value and as opposed to selling on price. Because number one, if you have a plan that costs $30 as opposed to some plans that cost $0, in my particular area, the plan that may cost $30 may cost $1 a day, but they have great customer service. You're gonna get covered with the doctors, you're gonna get your medications, no problem. They're always gonna be there. On the flip side of the coin, you choose a plan that's $0 for the whole year. You may be on the phone for 4 hours waiting to hopefully get somebody. Hopefully the phone call doesn't hang up. You may have an issue at the hospital, the doctor, or getting your medications. So we let them know that up front. This is what we recommend. You can always choose a $0 plan, but just be aware that this may happen. It's your choice. But in going with the $30 plan, for example, in our case, it alleviates a lot of the customer service issues, so that takes a lot of time off of our hands too.